We're gonna call these 9-month sliders. So this is kind of our high oblique position at 8 months, but maybe if we're moving around, we're a little above that developmentally. So in this position, typical kind of high oblique position, we'd be more or less like this. We're just gonna add in some side plates, put both hands down. Maybe we have this upper part of the leg, the femur coming in at about 90 degrees or perpendicular. Now, maintaining spinal elongation, we're just going to challenge the down hip external rotation, shoulder flexion, spinal elongation, lengthening the lats, hopefully being able to breathe at these end ranges, maintain pressure. What we don't wanna see is that if I'm facing down the camera here, that somebody is gonna deviate away from that hip because they don't have an alternative, right? That hip's a little stiff. Or we start to see that they curve their spine kind of in the side-to-side plane because maybe they lack a little bit of mobility. But we could also add a little bit of Gary Gray spice, right? Some triplanar, and say, well, let's pave a path down the middle. Let's go a little to the inside. Let's go a little to the outside. And again, always being sure that they can come back to home. So we're kind of using a little bit of a stability demand as well. And those are our 9-month sliders.